Well, I've been a dentist for over 30 years and also on the faculty at Pitt Dental School and with Aetna for the last 19 years. So from lots of different perspectives, I'm aware of the need for everybody to have access to dental care. And now that we're really talking about adults and especially seniors having access to care through the Medicaid or Medicare benefits, I'd like to be a part of that movement. So I want to be involved with everything that's going on around that initiative. The statistics show that if you have good oral health, your medical outcomes are better. And we heard today that the statistics are also showing that adult dental health is declining. There's a trend, a new trend, whereas dental health was getting better for adults, while it's still getting better for children, we've now reversed the improvement in dental health for adults. So those two statistics combined mean that it's really important. I think the issue is complicated. It's certainly, first and foremost, is coverage. People need to be able to pay for it. But it's really important that consumers or patients, the public at large, is aware of the importance. So health literacy, oral health literacy in particular is important. Oral health literacy for non-dental clinicians is important. You know, physicians, nurses, everyone in a capacity to treat patients who's not a dentist or a dental hygienist should also be well-versed in oral health literacy. 100%. It's the obvious place. That's where all older adults go for their medical care. And oral health should already be a part of primary care. We know that. We've talked about that for a long time. So it's the most obvious place. The information from the ADA's Health Policy Institute, so Marco's presentation was intriguing. Like I said earlier, the trend now that's reversed in oral health for adults is getting worse. I think the information we heard about insurance databases, Aetna's one of those databases that's been used for lots of research, lots of statistically valid research. It's nice to hear that everybody's aware of that research for all of the insurance carriers and that it feels like the room believes in the results. So all of that's been intriguing to me, and it's been, I think, an important way that we can increase advocacy for the issue is because we've got so much data. It's absolutely critical. The stakeholders are the ones who can really advance the issue, so everybody needs to be involved. It can't just be all of us who are involved in dentistry talking to one another. We need to get all the stakeholders involved. I think today's meetings attendees are a lot of the right people. It's pretty exciting to see the people in the room. I think we need more policy people and more corporate people, you know, people who are responsible for benefits at big companies. I think it would be helpful to have them in the room. Health benefits consultants. Those types of people would be helpful. Probably the most important are the policymakers. Well, a lot of us do have those Medicare Advantage plans that we heard about earlier, and a lot of them do either contain some dental benefits or offer a rider to add dental benefits. Aetna has Medicare Advantage plans that include inherent in the base plan some dental benefits. So I think it's important that we're at the table and in the room at these events to share our knowledge and our experience with those types of plans. We know that our clients do. We've been having those conversations with clients for over 10 years now, since our first published study came out in 2006. And overwhelmingly, we feel like they get it and they understand and they're appreciative of our program. Our program uses medical and dental data that's on the same platform and identifies people from their medical data and then encourages the people who aren't using their dental benefits to go see the dentist. And we know that our clients appreciate that, and even the ones who are self-funded. So if their people are going to the dentist more, they're paying for that, they buy into it too. It's their money, but they believe that it's improving medical health. Our program's unique because it is using data to target people at the most risk of not having good dental health, people with diabetes or heart disease or women who are pregnant. We make sure that they're the ones that are going regularly to the dentist, and because we're finding them and targeting them and doing the outreach, they don't really have to know anything about, they don't have to have the oral health literacy, they don't have to know about our program. We find them and do the outreach, and they overwhelmingly approve of it, like it. We get lots of member feedback saying how happy they were to have the outreach. So we create that engagement because we take somebody who might not have known about the importance of oral health and they become a believer.